we will go ahead and get started. Um, so my name is Dr. Joy Noble. I am a pelvic health physical therapist, and this is Pelotons and pelvic floors. So basically, we're just looking at today how an exercise bike, any exercise bike, this is not specific to Pelotons, but I do host something else called Pints and Pelvic Floors, and that we will talk about briefly later. So clearly, I like alliteration. Pelotons and pelvic floors went together better than stationary bikes and pelvic floors. So that's what you got. I'm a doctor of physical therapy. I've been a physical therapist for 8 years, and I've specialized in pelvic health that whole time. I have treated both orthopedics and pelvic health throughout. And then I added dry needling to my toolbox of things that I can do with my treatment in 2000. Oh, I should know this. 2018. So I'm excited to be here, and I'm really glad y'all have given me a little bit of time on your Tuesday night. Okay, so let's go. All right, quick disclaimer. I have to throw this in there. Not that I think anyone from Peloton is here watching this, not that they care. But first off, I'm not a representative for Peloton. This is totally my opinions based on research, like based on looking into things about the pelvic floor. And that is all this is reviewing. The other thing is that this webinar is not intended to be medical advice. It is just educational purposes only. I hope you learned some really interesting things. It's not, super long or in depth, but it's going to cover some really easy things you can implement immediately. I feel like we're kind of sick of getting tons of information just being sold to, but this is really just like simple stuff you can go home and fix immediately on your bike. If you have one, which I assume if you're here, you have one, or you're just here supporting and learning about the pelvic floor. The other thing is we are going to have some different like anatomy pictures because I think it's really important to understand kind of what and why things are happening to your body. So those will be on there. I will be referencing everything pretty gender inclusive. So I just want you to understand that. That is my viewpoint when I treat. That is how I treat people. So it's going to be more of a person with this or a person with that. So if that, confuses anyone, just kind of be aware that that's my language. So with our Pelotons, they've had a big rise. Thank you, COVID. They have reported that they had 4.4 million members in the year of 2020. It's a lot of pelvic floors. Of that, they have about 11,000 reviews, giving them an average of 4.8 stars. So clearly people who have Pelotons love their Pelotons. But I worry because that's great. Exercise is fabulous. I'd be a bad physical therapist if I told you I didn't think exercise is great. But it means that there's a lot of room for error or room for overdoing it or room for creating some kind of an injury from maybe just an improper setup that you can easily fix. So let's see if we can save about 30 of those 4.4 million pelvic floors. Okay, so this is the screen I was referring to earlier. This screen will show back up later. So the big thing we're looking at here is the anatomy of a pelvic floor. So over on the left-hand side of your screen, obviously you have the anatomy of a patient or a person with a penis. To the right side of your screen, you have the anatomy of a person or with a vagina. And in the middle is actually the same thing, and that would be the anatomy structures of a person with a vagina. This kind of butterfly shape here is the vaginal canal. This star shape up at the top is the urethra. The whole point here is really to take a note of where are these nerves, veins, and arteries in the body. So starting with the picture on the far left, we have these butt bones or sit bones, right? The thing we sit on. If you think of someone like sitting on your leg, it's like those bony parts. All of the muscles clearly wrap around and around that, attaching at the tailbone, attaching towards the pubic bone, going up the penis in this situation. And so the big things to note here are what are blocked off in red. So the ischial tuberosity, it's just that butt bone. That's what you're sitting on that seat with. And depending on the way your seat is, and this will be important later, and just kind of your pelvis shape, sometimes that seat is actually going to hit kind of on the inside of those butt bones or those ischial tuberosities. Then we have to look at some of these nerves, right? So things wrapped in the big red here again, just looking at there's a lot of nerves that are sitting between the butt bone on each side. We'll go up to the top here. Same thing, we have nerves, but we also have the arteries and veins. So the red and the blue here are also referencing that same thing, and they are going around. So this is that perineal body, just that in between a vaginal and rectal opening. We have the same thing on the picture here. Those structures are super, super important because that is what ends up being impacted when we sit on a Peloton seat or any kind of a spin bike seat, or even a bicycle you ride outside. Like if you really like the NCR trail or something like that, this can be impacting you there as well. Same thing, just a different view. This gives us some skin, so we have a little bit more understanding of what's happening on this picture of the person with a vagina. Again, that butt bone is here. Those nerves are running right around it, and they are going to go to the rectum, to the vaginal opening, and then up to the clitoral hood. And so all of these nerves are important because that's what gives us our sensation and our motor. And we want to be aware that that could be causing some issues kind of moving forward. Okay. Most common complaints or most common symptoms that patients will have or people have, a study did looking at numbness. So that sometimes we'll actually call it saddle numbness. It can be thinking of like a saddle from a horse or even a saddle from a bike, but saddle numbness, that's numbness in the genital region. 50 to 91% of riders that were interviewed reported this as an issue. Next is erectile dysfunction. 13 to 24% of riders experienced erectile dysfunction. That's those nerves, right? So those nerves go to the muscles and make the muscles do their job. Okay, well, if we're getting an impairment, that nerve is getting squeezed in a muscle or squeezed between the bike seat and the bones or something, we may end up with an erectile dysfunction issue. Symptoms in those with the vulva could be pain in the vulva, pain after urination and wiping after having ridden the bike, pain at the vaginal opening. And so vaginal opening is basically exactly what it says, the opening and inside. Vulva is the outside. Vulva is really like the labia majora minora. The other thing is swelling. So a lot of people with vulvas have reported having swelling in their labia. So noticing after a ride having a little bit more fluid in the area. Other symptoms for those with the penis is things like a blood clot in the penis, infertility issues, blood in the urine, inflammation, torsion. Some of these are extreme. So do not run out and panic, but in just kind of empowering people to know the things that can happen, this is what you should know. This information is, like I said, not to scare anyone. It's really just to empower your knowledge and to know what to look for. But again, we're going to learn some really easy things to adjust and to be able to fix and not end up with any of this, to recognize that prolonged riding in a improper setup could possibly lead to this. You're definitely way more likely to end up with more of the numbness, the erectile dysfunction, pain and swelling than you are anything down here in the lower section. Okay, so risk factors, and this kind of brings us back to how do we fix this? If your bike fit is just not correct, and this typically ends up being that the handlebars are too low or your seat is too high, and it's going to put you more in a forward position. If you're doing minimal position changes, I realize the coaches tend to be the ones who are running the show here, right? So they're the ones that are going to, tell you to stay in the saddle or tell you to get out of the saddle, things like that. However, you're all individuals. You can do whatever you want. So you can absolutely change up the program a little bit if you need to, and we will get into that in a bit. But that minimal position change, just staying there too long, is what's going to create that impingement because you're not giving the arteries, veins, and nerves room to kind of breathe by staying seated too long. Last thing is increased body weight. Take this with a grain of salt, really. I'm not a big person to harp on anyone in body weight, and we think too, like especially if you're someone who is working on like a weight loss program with your bike, you're kind of like, well, I'm damned if I do, damned if I don't. Like I am working out to help lose the weight, to get healthier, to have a better cardiovascular system or whatever it may be. But just, keep in mind that that is one of the risk factors, but it's definitely lower on the list of problems. Okay, so another research article shows prolonged sitting is going to decrease penile oxygen, so just oxygen getting down there. And this is showing you that if you got to a 60 to 65% max heart rate, right? So we're working on the Peloton intentionally to increase our heart rate. That will actually increase that oxygen up to 84% in 20 minutes. Again, I know Peloton has a bunch of different lengths of ride, but if you're doing 20, right, 20, 30, that seems like a pretty normal workout. That's part of the, AMA's recommendation for exercise. And so if you're doing 20 minutes on the bike and you've not changed position, you have a risk of decreasing 84% of your oxygen into the penis. That's not good. We don't want that, obviously. So keep that in mind as we move forward. Other big thing, an anterior pelvic tilt. This is leaning forward. I do a lot of work with the Womb Room and Bria Weber. She is fantastic, and she described this recently beautifully. So I'm going to take this from her and share it with you. When she talks about pelvic tilting, she talks about imagining your pelvis is a bowl of fish. So just lots of water. There's a couple fish in there. And when you tilt forward or tilt backwards, you're going to spill your water and your fish out, and you don't want to do that. So in an anterior tilt, that's basically imagining your pelvis is that fish bowl, and you are pouring the water out the front. So that's leaning the hips and the pelvis forward. You can imagine if you were sitting on a chair or on a bike seat, that's going to put a lot of pressure up through the labia and up through the testicles, or depending on how you're seated on the bike, it's going to put a lot of pressure. And that's where those nerves, arteries, and veins are that we showed in the first picture. So again, quick reminder, if you're getting that pressure from the seat, it's hitting all these important structures that we have going on. So do not sit in that front kind of lean forward position. And that again has to do with where the handlebar and where the seat is, right? If the handlebars are too low and the seat's too high, it's going to naturally tilt you forward onto this. So here's the gold. This is kind of the kind of what you came for. If you want to know, cross training, like it's, or if you want to know, you want to know how to fix it. So the biggest thing is cross training. If you've worked out for any length of time, you've probably been told to do this. You need to do other stuff, not just ride your Peloton. So try running, try swimming, do yoga, other Peloton classes. I know they have tons of classes. We're doing 2 months free. Like there's plenty of things you can do to help give your body a break from being on your bike seat. Now, having priced out the Peloton and the Peloton, or like the bike and the Bike Plus recently, I know if you spent that money on a Peloton, you're probably like, I'm riding this thing every day until I get it back. Excuse my typo. And I don't blame you, but give your pelvic floor a break. It's important. So watch your posture. Don't lean forward and compress the nerves, the arteries, the veins. Make sure your handlebars aren't too low and your bike seat's not too high. I was told by a rider that you can actually set up a fitting with the Peloton store. We have one in Annapolis, one in Columbia, I believe, one potentially in Rockville, like over that direction. And then one in Tyson's Corner, I want to say, is like the 4 that are closest to us. And if you're in Baltimore, Maryland, I know I have some people from Gig Harbor, Washington here, and those are not close to you. So they will actually help you go through a fitting for your bike in their store or the showroom to make sure you are set up appropriately. So if you want to do that, definitely check it out. Stand up. So give your pelvic floor a break. 30 to 60 seconds every 10 minutes of cycling. So again, in a 20-minute class, if you can get out of the saddle twice for 30 to 60 seconds, that will be ideal. You know, break it into however long your class is that you're doing, but being able to get out of that seated position and let blood and everything move through is perfect. And the last thing is that your seat matters. And so this is kind of what we talked about, depending on the shape of your pelvis and where those butt bones are. If you get a wider seat, you actually will get more distribution of pressure in your weight. So it's going to take some of that off of the pelvic floor area, especially if that seat kind of fits right between those bones for you. And then the other thing is to wear a pair of padded shorts for more protection if you just need some extra cushion there. Maybe you have less tissue in the area and just need some help. I will, not that I represent Peloton at all, but Peloton does sell padded shorts in their store. You can get them from any bike shop. They do also have a recommendation on their website for a compatible cushion for your Peloton seat that comes on the Peloton bike. I believe Schwinn is who makes that cushioned seat cover that'll fit appropriately, won't be too big or too small. So definitely check out their website if you are curious or if you have this. So I'm trying to get, there we go. Okay, no chat, no questions yet. All right, so I'm a pelvic floor therapist. Obviously, I treat the pelvic floor. I also treat a lot of pregnancy, during pregnancy, postpartum. So I can't not talk about a bike like this and not get to a little bit about pregnancy. So bear with me. I promise it's worth it. So stationary biking is actually one of the most recommended forms of exercise by the ACOG. So it's just the American College of Obstetricians and Gynecologists, people who take care of babies and pregnancy and postpartum. So This is good news for any Peloton owners that are, having COVID babies or wanting to have COVID babies. So good news there. Big things to remember when you're exercising and you're pregnant is to remain hydrated. You want to stay hydrated because it's also going to help you cool your body, because you also don't want to let yourself overheat. The other thing to consider is as belly gets bigger, like in this lovely picture here, you may need to stay in the saddle more. That tells me a couple things. Maybe shorten your ride to make sure that you aren't sitting down too long, or just do a couple rides, throughout the day or whatever you need to break it up, but definitely don't sit too long. But because that weight in our belly becomes so far forward, we run a risk of just feeling off balance whenever you go to stand to get out of the saddle with that belly and you come forward. The last thing is to listen to your body. So during pregnancy, if you've done it, you know it, you understand it. If you feel like you're getting tired, definitely stop or take a break. The best way to do this is to use the Borg exertion scale. Sounds silly and stupid or fancy. It's not super fancy. You can Google it. That's what I did here. Pulled off a picture. You're wanting to remain according to ACOG. So that is the governing body for all of our OBGYNs, is remaining between a 13 and a 14 on the scale, which is basically saying somewhat hard. The other is the talk test. If you can carry on a conversation while you're exercising, you're fine. And this is any exercise. So if you are pregnant or looking to get pregnant in the future and you're curious about being able to exercise and what's safe, this is their recommendation for exercise. If you're able to talk, you're not overexerting yourself. These are all great things to kind of keep in mind. Okay, so that was about it. If you are experiencing any pelvic floor symptoms, I urge you to see a pelvic floor therapist. We are different than a regular physical therapist. We have extra training to work internally on those pelvic floor muscles and to screen your low back, your hips, everything we need to make sure that we are treating all the muscles appropriately. There is help available for all of these symptoms. You do not have to live with any of it. You should not have pain. You should not be leaking urine when you're riding your bike. You shouldn't be having any discomfort or dysfunction. So if you are, I urge you to find a pelvic floor physical therapist. We'll evaluate everything and then get you back on your Peloton even sooner. Okay, so that was it. This is me. So Pints and Pelvic Floors is just a thing I have on Facebook. Basically, I am sharing all sorts of information about our pelvic floor. We talk about literally anything and everything you can imagine. If you're not sure what that involves, I encourage you to go find my Instagram page, scroll through, you'll find all sorts of information about what I do. My practice is in Federal Hill, West Montgomery Street inside of Vision, if you haven't been there before. There's a good coffee shop now in our building, but on the backside of my entrance called Morning Mug. So if you're looking for coffee in the morning, I'd check them out. That's my email, my website. If you're just curious, if you want to know more about what I treat, it's all down there. If you have questions that you don't want to ask in the next couple minutes while we chat, please feel free to email me and I will answer anything. And then I will send all this out as a recording for future. I hope you learned something new today or learned about part of your body you didn't know existed. And I hope you enjoy your Pelotons and have some good rides coming up soon. And that's it. So thank you for your time. And I'm going to stop screen sharing so we can do some question and answer if anyone has anything. And then you guys are free for the day. Okay, so you're welcome to unmute yourself, or you can pop a question in the chat and see if there is any questions or anything that we've hit that you're just curious about. Let me know. That's not bad. We're like right on 30 minutes. Sarah, you're welcome. I'm glad everyone was able to join tonight. I love talking about the pelvic floor, so we will talk about all sorts of things. Numbness, every time I have done a spin class, and now it makes sense why. Yes, exactly. That is super not, it's common, it's not normal. I love that phrase. It is common, but it's not normal. If you are dealing with this, you are not alone. It is such a common thing to experience. But again, that numbness, the pain, anything like that does not have to keep going. Does numbness resolve with breaks from riding? Yes, it should. So numbness should, if it is an initial onset, it should definitely resolve from riding immediately if it started immediately during the ride. However, our body does like to hold tension, especially in our pelvic floors. It is one of the number one places that we hold physical and emotional tension. And so if your body has started to guard and started to get tight, it's kind of like what our neck does, unfortunately, like after a car accident, like our shoulders kind of rise up. Our pelvic floor does the same thing, and it can stay that way. And then it can stay like stuck or guarded around a nerve. And so let's imagine we have a nerve and those muscles are fine, and then they get really tight and squeeze that nerve. You take your break from riding, yeah, life should be good. It should reduce. But if it's not, then you have something else going on. Again, you may have a muscle that's squeezing that nerve and causing that numbness. So if your breaks don't help, definitely reach out to a therapist. Let someone take a look at your pelvic floor and see if we can get some relief there. But that was a very good question. Anyone else? Any recommended seats? So not really. The biggest thing is, and I'm hoping Peloton comes out with a wider seat. It's finding a seat that's going to fit in your Peloton bike. The best thing you can do for the Peloton itself, since this is what this is about, I would say is either trying the cushioned shorts or the cushion that they recommend. And like I said, it's on their website. It's a specific cushion seat by Schwinn. Other bikes that are a little more standard, that you can take the seats out and put new seats in, you can get wider seats. But really it's finding one that fits your body the best. And every person is different, every shape is different. So it's going to kind of change the bike. So that's, yeah, good question. I don't have anything specific to recommend. I wish I did. You're welcome. Anyone else? Y'all are having some good questions. I'm impressed. No, everyone's quieting down. And like I said, if you have a question you don't want to ask here, or you feel like it's too personal, I will tell you, I talk about pee, poop, and sex literally all day long. So nothing is off my limits for me. But I totally understand that's not normal for everyone else. So you can definitely send me an email and I will answer any question if you feel like it gets a little too personal or anything like that. But otherwise, if you're watching this on replay, if you have any questions, please feel free to email me. I will be more than happy to respond. I will be sending out this recording to everyone that registered for the class. And I just really do appreciate your time. And yeah, I think we're going to wrap it up. Everyone have a great rest of your Tuesday. Enjoy the beautiful weather. Please stay safe, wash your hands, wear your mask, get vaccinated if you're so inclined. And hopefully I hear from somebody else soon. Bye.